Hi, I'm Pete, and I just want to talk to you a little bit about why it is I do what I do, why I'm here, why I'm teaching people these things, and why I'm trying to help as many people as I can get over physical pain, limitations, and injuries so that they can do what they love doing. Whether it's running, playing rugby, football, walking to the shops, although that might not be something you love doing, it might be something that you need to do. And you can't because it's painful. I want to help you to be able to do the things that you either need to do or love to do that you can't or find difficult because it hurts. It physically hurts. Your knee or your ankle or your hip, your shoulder, whatever it might be, something hurts. And I want to tell you about why I'm doing this. Okay, so for me, I started out playing football. It's quite a sporty kid, playing football, rugby, swimming, and kind of inevitably I picked up a few injuries along the way. Sprained ankle, strained ankle, calf injuries, knee injuries, sort of tight sore muscles, shoulder problems from swimming. And I've kind of carried that on through into my adult life. I was in the army for 10 years. And obviously being in the army, we push ourselves, we have to be physically fit to do the things that we have to do. I was an engineer in the army, and I left and stayed in engineering for a while. But that again, made me hurt. I'd spend a lot of my time in my car, which put me in a physical position that my body didn't like. I would get out with shoulder pain, a knee pain, ankle pain, and then I didn't want to exercise because everything was painful. I didn't really exercise for about a year after leaving the army. I didn't do too much, the occasional run, and that was about it. And perhaps if I had exercised, I wouldn't have had those pains, but because I was in pain, I didn't want to exercise. When I was in the army, I didn't run for 3 years. I couldn't. As soon as I ran more than a few hundred meters, my calves would hurt. And I knew the next day and for the few days after, I would find it a real struggle to walk without pain for the whole day, for 3 or 4 days after even just a short run. For me, 1 mile was pretty short. For some people, maybe watching this, 1 mile is pretty far. But in my early 20s, before I really kind of hurt, I was regularly running 5, 6, 7, 8 miles for fun. I enjoyed it. It's the thing that I love to do outside of my therapy work. Okay, I love treating people, but I also love running physically. That's the thing that gets me up in the morning. I love to do that. Mentally and money making, obviously. I need to work, and the thing I love doing is helping people get over their pains. The things that stopped me from doing the things I love doing was physical pain, and if that's the same for you, then I really want to help you. If you want to get back to sport, back to doing daily tasks that you might struggle with, combing your hair, brushing your teeth, that might cause pain in your shoulder. That might be a really difficult task for some people. It sounds silly to say it. For most people, that's fine. That's not a problem. But for some people, just doing simple tasks like brushing your hair, not something I particularly have a problem with. But for a lot of people out there, that's an issue. And I want you to not have those issues. I want you to get up and in the morning, put your feet on the ground and be able to walk down the stairs without your calves hurting. Be able to button up your shirt before you go to work and your shoulders work. Or comb your hair and it's not painful. Or brush your teeth. Or stand and make some dinner and it not hurt. I can't believe the number of people that go through life and a lot of the things they do are painful, but they get on with them because they don't know what else to do, and they take a pill and they go to the doctor and they might see a physio or they might go see some therapist, which is great. Go and do that. Go try and get it fixed. Please do. That's what I'm encouraging you to do. I want you to come see me, not those people. But go see somebody, okay? Get it fixed, because life in pain is horrible. You don't want to miss out on all the things that you want to do because you avoid them because you're scared of what it will do. I was scared for 3 years. I didn't run because I was scared that I would be in pain for 4 or 5 days, if not longer. You know, sometimes it was weeks or months that I was in pain for and struggling with before I eventually got on top of it. I was scared that if I ran, I'd hurt. I didn't want to do that. And I didn't know how to fix it, but I wanted to run. And I knew I wanted to run. So I had to remove myself from the army where I was forced to run. And I had to for my job. So I removed myself from that. I removed myself from an engineering job where I was in pain because I wanted to run. And I wanted to do all sorts of funny things. I'm quite enjoying trying to do handstands and stuff at the moment. That's interesting. So over the coming weeks, I'm going to give you some real quick tips that are not kind of common knowledge. They're a little bit out of the box, sort of thinking outside of the box. Thinking about the nervous system. If you've watched some of my videos in the past, you know I talk about the nervous system quite a lot, and the brain, okay, because that's what controls the nervous system. It's what controls our body. It controls everything that we do. All the words that are coming out of my mouth, the tongue and all that kind of stuff. That's all voluntary stuff going on up here. It also controls all of our involuntary stuff. I'm not going to get involved in that right now. This is not that video. But we need to look at the body from a different perspective. It's not knee pain, there's a problem with the knee. It's knee pain, there's a problem in my body. We need to look at the whole picture from the top down or from the bottom up, whatever it might be. There's pain somewhere. Let's look at the whole picture. And that's what I do. And that's what I'm capable of doing with the system that I work with. And that's called applied movement neurology, if you want to look it up. And that's what I do. So I'm encouraging you to get out of pain, to do the things that you love to do, because that's the most important thing. Don't avoid the things that you love. Don't avoid the things that you have to do as well, because you have to do them. Things like cooking and eating, we have to do them, but let's do them without pain. Things like brushing your hair, you kind of have to do it, otherwise you look like you've just been in a hurricane. Okay, it's kind of windy outside today. Let's not look like that. You need to brush your hair. You need to clean your teeth. Let's do all of those things without pain. Let's avoid those. Let's remove the pain, retrain it, retrain your body, retrain your nervous system, and remove pain from everything that you do so that you can enjoy life, so that you can do the things that you love doing, whatever they may be.